Okay, welcome back to the deep dive.
Good to be here.
Today, we're really zoning in, taking a focused look at a specific medical thing affecting cats. We're using that snack of sources you've shared with us as our guide.
That's the plan. Think of this as us trying to pull out the most important bits from those articles and notes you sent over.
Right.
Our mission, basically, is to get a solid handle on feline perirenal pseudocysts.
Okay.
What are they? Why are they still a bit puzzling? And what do your sources say is really crucial to know?
It's like we're detectives, yeah.
Yeah,
And your material is the case file.
exactly.
So let's jump right in. What are we talking about? That name, perirenal pseudocyst. It's a bit of a mouthful.
It is, yeah. And your sources actually mention it goes by quite a few other names, too.
Oh, like what?
You might see capsulogenic renal cyst, maybe capsular cyst, perirenal pseudocyst, even capsular hydronephrosis.
Wow, okay. Lots of names.
But, whatever name they use, the core idea is renomegaly.
Renomegaly. That just means enlarged kidney, right?
Mm-hmm. Exactly. Enlarged kidney. But the enlargement here is caused by fluid collecting between the actual kidney and its outer layer, the capsule.
Okay, enlarged kidney, fluid around it. Got it. But what about the pseudo part? Why isn't it just a regular cyst?
Ah, that's a really key detail the sources highlight.
Mm-hmm.
So in a true cyst, the wall lining the fluid sac is made of a specific type of cell, secretory epithelial cells.
Okay.
But the tissue around the fluid in these cases, it doesn't have that special lining.
Ah,
So pseudo just means false. It looks like a cyst, feels like one maybe, but structurally it's not quite the same.
got it. Fluid around the kidney, no fancy lining, makes the kidney look bigger. Does it usually hit one kidney or both?
It can be either. Sometimes just one, sometimes both kidneys are affected.
Okay, now this is where your sources got really specific and I thought really interesting. Who typically gets this? Any cat.
Yeah, that's a pattern that definitely jumps out from the material.
Yeah.
It primarily affects older male cats.
Older males.
Typically, yeah, think 8 years old or older. The sources do say if you happen to see it in a younger cat, it's usually just on one side unilateral.
So mostly older gentleman cats then.
Pretty much.
And is this a cat-specific thing or do we see it in dogs, other animals?
Well, that's another fascinating point your sources bring up. It's actually quite rare in dogs.
Really? Why the difference?
The materials suggest it's a theory, mind you, but it might be linked to something unique about cat kidneys.
What?
They have this really prominent network of veins right under the capsule, these subcapsular veins. Dogs don't really have that same prominent structure.
Huh. So the cat-specific plumbing might make them more prone to this fluid buildup.
It's a possibility that anatomy plays a role, yeah. That difference could be why we see it so much more in cats.
That's a great insight tying the anatomy to who gets it. Okay, so if an older male cat might be susceptible, what would an owner or a vet actually see? What are the signs?
Well, interestingly, your sources mention that some cats can actually be asymptomatic.
No signs at all. That makes diagnosis tricky.
It definitely can. But if there are signs, a really common one is abdominal enlargement that isn't painful.
So a bigger belly.
Yeah, you might notice the cat's abdomen looks distended, feels a bit full, but when you gently press on it, the cat doesn't seem painful.
Okay. And since it involves the kidneys, does it affect kidney function? Any signs related to that?
Yes, absolutely. Some patients will also show signs of concurrent renal failure or, chronic kidney disease, CKD, especially if the kidney tissue itself was already compromised.
Right. So the pseudocyst might show up alongside existing kidney problems.
Or perhaps exacerbate them, yeah.
Okay, so here's the big question, the mystery. Why does this fluid actually build up, especially in these older male cats? Your sources looked into causes.
They did, but honestly, the material makes it clear the exact why isn't fully understood.
Still a bit unknown then.
Yeah. What the sources do stress is that this isn't usually a static thing. The fluid accumulation is described as dynamic. It can change.
Dynamic, meaning it can get bigger.
Yeah.
Or smaller.
Generally bigger, or refill if drained. And figuring out why it's accumulating, that's where testing the fluid itself becomes important.
Analyzing the fluid.
Yes. Cytology, looking at cells and biochemical tests on that perirenal fluid, can give clues about what's driving the process.
Okay, so what are the leading theories? What kind of mechanisms do the sources suggest?
Well, one possibility is that the fluid is what's called a transudate.
Transudate.
Yeah, it's basically fluid that leaks out of blood vessels, usually due to imbalances in pressure. Think high pressure inside the tiny capillaries around the kidney, or maybe a blockage in the lymphatic vessels that are supposed to drain fluid away.
Okay, leaking fluid. What might cause that pressure or blockage?
The sources mention that sometimes when they look at the kidney tissue microscopically, they see signs of renal fibrosis.
Scarring.
Exactly, scarring or thickening. Now, the question the sources raise is, does this fibrosis actually cause those vessels or lymphatics to get blocked, which then leads to the fluid leaking out?
Ah, so it's a potential link but not confirmed.
Correct. The sources say it's unknown if there's a direct cause and effect there. It's a plausible mechanism, but not definitively proven.
So fibrosis leading to leakage is one idea. What else could the fluid be?
Well, transidate could also theoretically happen if existing cysts within the kidney rupture outwards. But another distinct possibility is that the fluid isn't transidate at all. It might be urine.
Actual urine leaking out.
Yes. If the fluid analysis confirms it's urine, that tells you there's likely a tear or some disruption in the renal pelvis, the collecting area in the kidney, or the very top part of the ureter, the tube leading to the bladder.
Wow. Okay, so it could be leaky blood vessel fluid or leaky urine. Any other options?
Yes, the sources also mention that sometimes the fluid is actually blood.
Blood. How would that happen?
Several ways.
Yeah.
It could be from external trauma, maybe complications from surgery near the kidney, or a tumor eroding into a blood vessel, or even things like a ruptured aneurysm, problems with blood clotting coagulopathies, or sometimes, believe it or not, bleeding caused by the very act of trying to drain the fluid, the paracentesis procedure itself.
That's quite a list of potential fluid sources. Leaky vessels, leaky urine, or blood. Given all that, how does a vet figure out what's really going on? How's the diagnosis made?
Right. The first step is thinking about what else could make a kidney look big or cause a swollen belly.
Differential diagnoses.
Exactly. Your sources list things like kidney cancer, renal neoplasia, or hydronephrosis, which is swelling from backed up urine.
Okay.
Also, polycystic kidney disease, which is actually pretty common in cats, especially certain breeds. Then there's FIP, feline infectious peritonitis, and less commonly fungal or bacterial kidney infections.
So rule out the other kidney issues first?
And rule out other reasons for a big belly, like ascites fluid buildup in the abdomen generally, or maybe just another organ being enlarged.
Makes sense. What tests help pin it down to a pseudocyst?
Routine blood work CBC, chemistry panel, and a urinalysis are often done. But interestingly, they're often pretty unremarkable early on.
The blood tests are normal.
They might be, yeah. They usually only start showing significant changes once the cat's kidney function is really impaired. If there's underlying chronic kidney disease, then you'd see things like azotemia waste products building up in the blood and urine that isn't properly concentrated, usually a specific gravity less than 1.035.
So the basic labs tell you more about the health of the kidney, not necessarily about the fluid bubble itself.
Precisely. For actually seeing the pseudocyst, imaging is absolutely key.
X-rays.
Plain X-rays, or radiography, can often show that one or both kidneys are enlarged. But to really see the fluid clearly and, importantly, assess the state of the kidney tissue underneath the fluid, you generally need more advanced imaging.
Like what?
Excretory urography, where they inject dye, or more commonly nowadays, ultrasonography. Ultrasound is great for this.
And what do you typically see on an ultrasound? What's the classic picture?
A very common finding, described clearly in your sources, is seeing kidneys that might actually be small, maybe even a bit shrunken.
Small kidneys. But the problem is enlargement.
Right. Small kidneys sitting underneath this abnormally wide, fluid-filled space, all contained within the stretched-out kidney capsule. It's quite a distinctive image.
Okay, I can picture that, a little kidney swimming in a big fluid sac. And how do you figure out what kind of fluid is in there? You mentioned analyzing it.
Exactly. That involves doing a diagnostic paracentesis.
Sticking a needle in.
Carefully, yes. Drawing out some of that fluid with a needle and syringe. That fluid can then be sent for testing cytology and biochemical analysis.
And what does cytology tell you?
Looking at the fluid under a microscope can give big clues. Is it clear fluid, suggesting transidate? Are there red blood cells indicating hemorrhage? White blood cells suggesting inflammation or infection? Maybe even urine crystals?
Okay, so the cells give clues. How do you know for sure if it's urine leakage?
There's a specific test for that. The sources state that measuring the creatinine concentration in the pseudocyst fluid is key.
Creatinine, like in the blood text for kidney function.
The very same. If the creatinine level in the fluid from the pseudocyst is significantly higher than the creatinine level in the cat's blood serum,
Then it must be urine.
that's considered diagnostic for urine leakage, yes. It confirms that urine from the urinary tract is getting into that perirenal space.
That's a neat diagnostic trick. Okay, so we get what they are, who gets them, the signs, the complicated potential reasons why, and how vets diagnose them. What about treatment? Do the sources say this is an emergency?
Generally, no. The good news, according to the material, is that the pseudocysts themselves aren't usually an immediate, life-threatening crisis.
That's relief.
And some cats, especially if they have no symptoms and no sign of kidney disease, might not actually need any treatment directed at the pseudocyst itself.
Really? Just leave it.
In some cases, maybe. But often, the bigger issue is diagnosing and managing any concurrent chronic kidney disease. That's frequently the main focus for long-term health.
Right, treat the underlying CKD. But if the pseudocyst is causing problems, like the belly is huge, what can be done?
For the pseudocyst itself, surgical options are described in your sources.
Like, do they take the kidney out because it's got this thing around it?
Actually, the sources specifically advise against removing the kidney nephrectomy, if at all possible,
Why is that?
to preserve as much kidney function as possible. Remember, CKD is often lurking. So the surgical procedures mentioned are things like capsulectomy, removing the entire capsule,
A whole outer layer.
or perhaps more commonly pseudocyst fenestration.
Fenestration. Sounds like making a window.
Exactly. You create one or more openings in the capsule wall. The idea is to let the fluid drain out continuously into the abdominal cavity, where the body can hopefully just reabsorb it.
Does that work well?
The sources suggest making the opening reasonably large, like bigger than 1 centimeter by 1 centimeter, to try and stop it from scarring over and closing up again.
And do these surgeries make the pseudocyst vanish forever? Do they cure the cat?
Well, they're generally pretty effective at relieving the physical problem, the abdominal distension, the pressure on other organs. That discomfort usually gets better.
Okay, that's good.
The sources mentioned that if there's only early-stage CKD present, it might even resolve or stabilize after the surgery decompresses the kidney. But progression of the underlying CKD is still common even after successful surgery. And the long-term response, like whether the pseudocysts never come back after surgery or the definitive impact on kidney disease progression, the sources say that's actually unknown.
So surgery helps with the immediate swelling and discomfort, maybe helps early CKD sometimes, but it's not necessarily a permanent fix for the whole situation, and the CKD might still get worse.
That seems to be the gist of it, based on the material provided. It addresses the physical manifestation, but maybe not always the root cause or the kidney disease itself.
What about less invasive options? Can you just drain the fluid?
Yes, paracentesis, draining the fluid with a needle, can provide temporary relief.
Temporary. Does the fluid just come right back?
Your sources indicate that yes, the pseudocysts often refill after being drained, typically within about 1 to 2 weeks.
So you have to keep doing it?
It can be repeated if needed for symptomatic relief, yes. It's less invasive than surgery, but often not a long-term solution on its own.
Are there any medications, drugs that could shrink the fluid or stop it accumulating?
Not really for the fluid itself. Medications typically only come into play if the pseudocyst fluid gets infected.
Infection.
If that happens, then yes, antibiotics are needed. The sources suggest choosing one based on culture and sensitivity testing of the fluid, and they specifically mention considering a lipid-soluble antibiotic, which might penetrate the area better.
Okay, so treatment is mainly managing symptoms, managing the CKD, and surgery or drainage for the fluid itself, if needed. What about follow-up? And what's the overall outlook, the prognosis?
Monitoring is definitely key. The sources recommend regular checkups for these cats, maybe every 2 to 6 months,
Checking for what specifically?
primarily looking for the development or the progression of chronic kidney disease, monitoring those kidney values and urine concentration.
And the prognosis, how do these cats tend to do?
The short-term outlook seems reasonably good, according to the sources, especially for cats that don't already have significant CKD when they're diagnosed. And that seems to be true whether they have the pseudocyst drained or decompressed surgically or not.
Okay, short-term is decent. What about long-term? Does this always cause major problems down the line?
Well, this is where the sources point out some significant unknowns. The long-term prognosis isn't really fully determined.
Still uncertain.
Yeah. For instance, it hasn't been clearly established if these pseudocysts are definitively linked to some kind of underlying progressive damage happening within the kidney tissue itself. We don't know if the cyst causes further damage or if it's just a marker of damage that's already happening.
That's a really crucial point, isn't it? Cause or effect.
Exactly. And it's also unknown, based on this material, if the condition is associated with hypertension, high blood pressure, which often goes hand in hand with kidney disease in cats.
So lots of questions remain about the deeper mechanisms and long-term consequences for the kidney itself.
That's right. So ultimately, the sources suggest that the cat's long-term survival seems most closely tied to the severity of any concurrent CKD and how rapidly that kidney disease progresses.
The pseudocyst itself is often secondary.
It often seems to be either a sign related to the CKD or a complicating factor rather than the primary life-limiting problem in many cases.
Okay, so let's try and wrap this up. We've taken a real deep dive into feline perirenal pseudocysts, guided by the sources you shared. We've clarified this fluid collection between the kidney and capsule, known by many names. We've seen it has this striking tendency to affect older male cats, rarely dogs, a key clue.
Right.
We talked about the signs, sometimes none, sometimes just a non-painful belly bulge, often alongside signs of kidney trouble. We dug into the potential, though still murky, reasons why leaky fluid, leaky urine, blood.
Have different possibilities for the fluid's origin, yeah.
We covered how imaging, especially ultrasound, and analyzing the fluid itself, checking that creatinine level, are vital for diagnosis.
Crucial steps.
And then treatment, often focused on managing any CKD with surgery or drainage as options for the pseudocyst swelling, but with the understanding that long-term outcomes regarding the cyst and kidney progression aren't fully known.
It really underscores how a condition can look quite specific, yet be tangled up with broader systemic issues like chronic kidney disease, and still have elements of mystery around its fundamental cause and effect.
Absolutely. And that very fact that even with our diagnostic tools, the precise cause in many cases and the exact long-term impact on the kidney remain, well, elusive.
Hmm.
That does leave us with something to think about, doesn't it?
It really does. And perhaps this raises a broader question for you, the listener, to consider. When a relatively distinct condition like this, even one we can visualize and sample, still holds significant unknowns about its ultimate why and its long-term path, what does that illustrate about the ongoing challenges and, frankly, the necessity of continued research in veterinary medicine to truly unravel the complexities of diseases we encounter?
A really important thought to end on. Thanks for joining us for this deep dive into your source material.